Good morning, everyone. My name is Dr. Rivas. Thank you, Kim, for hosting me. I'm very excited to talk about ketamine therapy. As the title suggests, we're going to talk about ketamine as a catalyst for healing and transformation. So a few disclosures here. First off, this is informational presentation. This is not a substitute for medical advice. And today we're going to be talking about the off-label use of specifically IV ketamine. So a little bit of background about myself. I opened up an IV infusion ketamine clinic approximately a year and a half ago. We're located in the Central Coast, and our clinic utilizes ketamine-assisted psychotherapy. A little bit different from most clinics around the country. I'm a big believer in the psychotherapy. I think it's just as important as the medicine. Our team consists of two ketamine-assisted psychotherapists, Cindy, Ali, psychologist, Justin, Libby, our clinic manager, and then Ellie, our therapy dog. A little bit of background about me. Prior to this clinic, I was a general and trauma surgeon, practicing first in Texas, but then in California. And a bit of background as far as my personal experience with ketamine. So first off, I use ketamine very often in trauma patients. When they would come in after a car wreck or gunshot wound, I chose ketamine because it's a very safe medication, very effective medication for pain and acute anxiety. I became very comfortable with it over the years, using it as a surgeon. I also had my personal hardship with a divorce 4 years ago, which spiraled me into a deep depression. Always being very hesitant of medications and antidepressants, I actually chose to do infusions myself. So I underwent a series of 6 infusions, and it was very profound, very life-changing. First off, it lifted the depression, but secondly, it really showed me the beauties of this medication so much that it helped me make big decisions in my life, helped me decide to change careers. So I opened up this ketamine clinic, the one and only, and at first I was doing both trauma surgery and this clinic, but within 3 months, it became very obvious that my passion, my heart lied in ketamine therapy. So since then, I've been focusing 100% of my efforts in this clinic. So some key things we're talking about is why scientists believe that ketamine may make psychotherapy more effective. We're going to be talking about the 2 most popular routes of off-label ketamine, including oral and IV. The 3 phases of ketamine therapy, including preparation, the medicine journey, and integration. 4 common misconceptions about ketamine therapy, and a few ways that therapists like yourselves can potentially learn more and become involved. So first off, what is ketamine? Ketamine is a dissociative anesthetic used for anesthesia and has been for the past 40 years. However, at low doses, it can be very effective for mood disorders, including depression, anxiety, PTSD. When we use it for these indications, it's important to note that this is sub-anesthetic, so much lower doses. Ketamine is a very fascinating medicine in that it has certain effects at different doses. So, for example, at the anesthetic doses, it will have none of the mood disorder effects. Whereas in a specific window around 0.5 to 1.5 milligrams per kilogram, it can have very robust antidepressant effects, but also help with alleviation of pain. Ketamine is a fascinating that it's comprised of 2 molecules, the R form and the S form. Consider them mirror images of each other, or 2 gloves. Both molecules, however, are important. Both molecules are in IV ketamine, whereas the S form is just in the nasal spray and a lot of the lozenges. The S form has good analgesic properties. However, the R form appears to have more antidepressant and more enduring effects. So again, both of them are very important. I'm often asked, is ketamine a psychedelic? Ketamine is not technically a classic psychedelic like LSD, psilocybin, MDMA. However, it does have psychedelic properties, one of which being dissociation. And we'll talk about that and how that could be a therapeutic space. So a brief history of ketamine. So ketamine is a very old drug, first synthesized in 1962 by chemist Kelvin Stevens. And he was tasked with the job of modifying phencyclidine, or although it gets a bad rap, it actually was a very effective anesthetic. The problem was it was too long lasting. And when patients came out of anesthesia, they would have what's known as emergent reactions. Sometimes they'd have confusion, convulsions, less than ideal reactions is what they would experience. So again, the chemist Kelvin Stevens modified the molecule so it was shorter acting and without the undesirable side effects. Fast forward a few years, and it was first FDA approved in 1970 for general anesthesia. and is still commonly used every day in anesthesia or in emergency situations. It's on the World Health Organization list of essential medications, including penicillin and morphine. Then in 2000, the first study showed that ketamine at low doses had antidepressant effects. Since then, there's been many, many studies replicating these findings and also broadening indications to anxiety, PTSD, and different mood disorders. It's important to note that ketamine is FDA approved, but that's just the nasal spray, and that was FDA approved in 2019. First for treatment-resistant depression in conjunction with an antidepressant. And then a year later, it was FDA approved for major depressive disorder with acute suicidal ideation and behaviors. Ketamine was commonly used in the battlefield, specifically in Vietnam War. It's a very attractive anesthetic on the battlefield because being that it's very safe, patients don't require a breathing tube when they get this anesthetic. And rather than dropping blood pressure like many of the other anesthetics, ketamine can actually elevate heart rate and blood pressure, which is ideal when people are hypovolemic or they've been bleeding from a traumatic injury. So what are we treating with ketamine? Mental health. However, there's a number of studies showing that ketamine can be effective for other indications as listed here. And perhaps the most common indications that we see at our clinic are going to be depression, anxiety, post-traumatic stress disorder, and substance abuse, specifically alcohol. So what can someone expect for a response rate? Well, specifically for depression, using ketamine alone, so without the psychotherapy, one can expect a response rate about 70 to 80%. We also treat chronic pain. Ketamine is a fascinating medication that it has different effects. The mechanism is actually different for the mood disorders for pain. So it's not about blocking the pain receptor, but rather blocking the perception of pain. And it can be very profound, very effective for patients. We've had patients who have had surgeries, have been on opioids, and this is kind of last resort for them. And we've had people who didn't even complete the series of infusions because their pain was gone. They were able to come off their opioids, come off their pain medications. So it can be very effective for some, but obviously not for everyone. So let's talk a little bit about the mechanism of action. Perhaps the most well-known mechanism or theory behind ketamine's effects is its effects on the NMDA receptor. This is a glutamate receptor, and by blocking this, it can have excitatory and inhibitory effects. Basically, it can induce a process called neuroplasticity. Perhaps Michael Pollan said it best, and he's the author of How to Change Your Mind. And basically, when patients are depressed after years of trauma, they get kind of stuck in their ways. They think a certain way, they act a certain way. Ketamine acts like a fresh coat of snow, where patients are able to take new pathways. So think of it like a mountain that has melted snow with well-defined tracks. These are patients' behaviors or thought processes that may be unhealthy. This fresh coat of snow allows patients to take new pathways. However, it's important to have professional guidance on making changes. Although they can make new pathways, they can also make the same mistakes again. Ketamine has multiple effects on multiple receptors, including molecules, including serotonin, dopamine. So it's a very fascinating medicine. Also, ketamine has known anti-inflammatory effects. There's a strong link between depression and inflammation. So ketamine has shown to decrease inflammatory molecules like cytokines. And that's probably why it works so well, or can work very well, for inflammatory disorders such as inflammatory bowel disease, fibromyalgia, even for arthritis. And perhaps my favorite mechanism is that of critical periods, or reopening critical periods. And this concept came from Professor Gould Dahlin. She's a professor at Johns Hopkins University. And she's probably best known for her study on octopus using MDMA. Anyways, ketamine and other psychedelics can induce or open up a critical period. Think of this as inducing a youthful state for the mind. Similar to when we're young, it's easy to learn a new language, learn a new sport, play the piano. As we age, it becomes more difficult. This critical period appears to close. It's harder to learn. Whereas when we use ketamine or other psychedelics, this window reopens. And they think that it's correlated to the subjective effects. For example, ketamine, that window may be about 48 hours, whereas ibogaine, the longest acting psychedelic, that critical period could open for weeks. So this is a good time to incorporate psychotherapy incorporate the lifestyle changes. It's important also to note that context matters because there's potential for harm. After a psychedelic experience, after a ketamine journey, the mind is very malleable. So ideally, you want to foster a very nourishing environment versus a chaotic lifestyle or some trauma-inducing event. So I always tell patients after their infusions to take care of themselves, do things that are good for them, but also avoid their environment that may be toxic for them. So let's talk about the different routes of administration. At Innerbloom, at our clinic, we use primarily IV ketamine, intravenous ketamine. We may use intramuscular ketamine for patients who have aversion to needles or when we have difficult access, but I would say about 99% of the time it's IV. And we do this for two reasons. Number one, IV ketamine is the safest option. And number two, it's the most effective. By safety, the beauty of IV ketamine is I have control. Should there ever be a reason to stop an infusion, I simply push a button on the infusion pump and the medicine wears off within minutes. It's the most effective, and that's supported by literature. Again, the vast majority of literature revolves around IV ketamine. IV ketamine is 100% bioavailable, which means 100% of the medication is absorbed in the bloodstream, which allows us to use the lowest doses possible and lessen the risk of any side effects. IV ketamine has both forms of ketamine, the R form and S form. And as we talked about before, both of them are important. The next route of administration is nasal ketamine, also known as S-ketamine, under the brand name of Spravato. Again, this is just the S form. It's less effective. It's less bioavailable, about 40%. And absorption depends on the patient. It's obviously intranasal, so patients' absorption is dependent on their mucosal membranes and other factors in regards to the specific patient. Another issue with the nasal spray is the dosages are limited to just 56 and 84 milligrams. And to put things in perspective, that's about 22 and 30 milligrams IV. At our clinic, our lowest starting dose has probably been 25 milligrams IV. So my concern is with the nasal sprays that patients are being far underdosed. They may never reach that therapeutic level, but we're not sure either because we don't know what their blood levels are because we're not putting the medicine directly into the bloodstream. So not a huge fan of that because, again, it just doesn't appear to be as effective. And I don't like the fact that patients are labeled big and small. You know, the beauty of IV ketamine is we can be very precise with the dose. We can find the optimal dose, the Goldilocks dose for each patient. Whereas the nasal spray and the oral lozenges is somewhat of a guessing game. And then perhaps the second most common is going to be the oral form. This is going to be the least bioavailable, about 20 to 30%. Because of such of a low bioavailability, we have to use much higher doses to have a therapeutic effect. And as such, patients often do have side effects. There's inconsistency as well. The oral forms come from compounding pharmacies. The FDA just last year issued a warning stating that ketamine coming from compounding pharmacies are not tested for quality. So there's obviously concerns there of what you're getting, how much you're getting. And then the oral forms really opened up the door for abuse, and we'll talk about that in a bit here. So a few more words about the nasal form under the brand name Spravato. So this is the one and only FDA-approved form of ketamine. However, research continues to support the fact that IV ketamine is superior. For example, IV ketamine requires less amounts of treatments to achieve remission. Up to date, perhaps the most well-known medical, a lot of practitioners use for guidance on how to practice evidence-based practices, just recommended IV over ECT, which is considered the gold standard for treatment-resistant depression, and the nasal forms Spravato. So let's talk a little bit about at-home ketamine. I'm sure a lot of y'all have seen some advertisements for at-home ketamine. And while it seems like a good idea, perhaps for some, patients are getting ketamine at a lower cost in the comfort of their own home, there are some concerns. There are some red flags. Research has shown than 50% of patients who use at-home ketamine do so inappropriately, often at doses higher than intended. My greatest concern is the often lacking of preparation, guidance, monitoring, and integration and follow-up. Some patients are given blood pressure monitors, and that's really up to them if they want to use it or not. They may be videotaped. They may just simply do this alone, which is really concerning for me because especially when patients are naive to ketamine, have never had a ketamine experience or any psychedelic experience, it can be frightening. It can be confusing. And if there's no one there to monitor them, to reassure them, to keep a close eye on them, what's to stop them from getting in the car and hurting someone else? So really concerning regarding the at-home use model. And I do foresee in the future there'll be more regulations in place to limit the use of at-home ketamine therapy. I understand that some at-home ketamine therapy businesses are really hoping to address affordability access. However, a lot of them do seem to be very profit-driven. And a lot of this at-home ketamine therapy has led to addiction. Patients are allowed to dictate their own care, and oftentimes they misuse and they abuse ketamine. Whereas ketamine should not be used like an antidepressant, but rather it should be used sparingly with a lot of preparation and a lot of aftercare. Ketamine is not like another antidepressant, which you take daily to alleviate symptoms without mindfulness. It's really about having a lot of mindfulness, a lot of intention, and use it when you need it and when you have the guidance. So let's talk a little bit about the dosing, specifically IV ketamine. So IV ketamine is given over a series typically of 6 infusions over a course of 2 to 6 weeks. And the starting dose, the threshold for antidepressant effects is 0.5 milligrams per kilogram. And the infusion is 40 minutes. Again, like I mentioned, the beauty of IV ketamine is we know the blood levels. We start at 0.5, but oftentimes clinics or providers like myself, we will titrate up depending on the patient's experience, their diagnosis, and their symptoms, or hopefully the alleviation of symptoms. Research has shown that patients who have anxiety or suffer from substance abuse disorders may require a higher dose, such as 0.7 milligrams per kilogram. So it's really about finding the optimal dose, the right dose for each specific patient, rather than taking a cookie cutter approach, which is often the case with the nasal spray or the oral lozenges. And here's just an example of how we may set up our infusions. Ideally, it's best that a patient has a psychotherapy appointment after each infusion. And that really helps to integrate the process. But certainly they should start the process, or they start the process with us with psychotherapy. And that's to get to know them, to help them prepare for these infusions. Preparation is huge, and we'll talk about that in a bit. So there's an important concept in regards to ketamine therapy. There's the induction phase and the maintenance phase. So the induction phase relates to a series of typically about 6 to 10 infusions. The standard is, for the most part, is 6 infusions. However, sometimes we may choose to extend the number of infusions to 8 or 10, depending on the type of response the patient is having. For example, a patient who responds very early to the medication, meaning they feel much better after 1 or 2 infusions, that's great. That patient will likely undergo 6 and that's it. Some patients who respond late in the process, for example, 4, 5, or 6 infusions, there's a clear turning point or breakthrough where they start to feel better. And if that's the case, then we may choose to extend the series, understanding there's more work to be done. And then there's also non-responders. Even despite our best efforts, the best intentions, some people simply do not respond to the medication. That's about 15 to 20%. After this series of 6 infusions, then we wait and see. Some patients come back periodically throughout the year for additional infusions. We call them boosters. However, the majority of people don't. At our clinic, for the patients who've undergone a series of 6 infusions, we have found that 14% of patients come back for boosters. And the average duration is every 3 months. This ranges at our clinic from one patient coming once a month to once a year. I'm often asked by patients if they can come off their medications, off their antidepressants. This is often a goal for a lot of patients. They're very frustrated with their antidepressants, whether that be lack of efficacy, side effects, the numbing effects it can have. And while this is very possible, we've had a lot of patients come off antidepressants. I always tell people to wait, undergo the series of infusions first, and let's just change one thing at a time, adding ketamine. After the series, if patients have had a robust response, then certainly this is a good discussion to have with their prescriber and come up with a plan to taper their doses or even come off them. Same goes for pain medications. However, some patients just don't listen to me and they'll still taper their doses of antidepressants or pain medications and still have great results. But I always recommend, waiting and under the guidance of the prescriber in a slow, tapered fashion to prevent any rebound effects. What are some reasons that people do not respond to ketamine? Taking aside the people who just simply don't respond for whatever biochemical reason. I think the main ones are going to be inadequate preparation and unrealistic expectations. Ketamine is not a magic pill. Ketamine is going to take work, and patients need to understand that. They need to understand that this is not like any other antidepressant. They're going to do a lot of themselves with a therapist, come up with plans, but also do a lot of work after the infusions and in between infusions. Those who expect this to be easy, expect this to be pleasant, are often going to be disappointed. Sometimes it's challenging. Oftentimes, patients do enjoy the infusions. As they continue to go, they feel more therapeutic, deeper, I often hear. But sometimes it's not pleasant. Sometimes it's challenging throughout the whole series and very uncomfortable. But our clinic, obviously, we want to make the experiences as comfortable as possible, but we're ultimately most interested in what happens afterwards. We've had patients who've had uncomfortable experiences, infusions, every single one, but they feel better. They're not depressed. They're coming off their medications. So that's the ultimate goal. I always tell patients, if you're going to do this process with us, to lean into it, to trust the process and see it to the end. Those who decide to pull out after a couple infusions because either they're not responding yet or for whatever reasons, it's unfortunate. Obviously, we'll allow it. We're not going to force anyone to do what they're not comfortable with, but it's unfortunate because although they may not have a good response after 1 or 2 infusions, if they're a late responder, we'll never know if they stop too early. Another reason why people may not respond is the setting. People may not be ready to receive this medication. They may be doing it for the wrong reasons. If they're doing this at home or at a clinic that they don't feel comfortable with the providers or the process, then it won't really be conducive to healing. And then potentially patients can have interactions with some medications, specifically benzodiazepines and Lamictal. Those patients who take these medications aren't excluded from ketamine therapy. However, we do typically recommend that they talk to their prescriber and potentially hold their medications the day of their infusions. The concern here is that these medications can make ketamine less effective. It's not a safety issue, but more efficacy issue. Having said that, we've had many patients who are unable to come off their benzodiazepines and they continue it throughout the series or the Lamictal, and they still have great results. So it may be more theoretical than actual, but we always, we mention this to patients, and if we're able to hold their doses, then that's what we recommend. We also recommend that patients refrain from using cannabis or alcohol throughout the series, a couple days before, a couple days afterwards, because there is evidence to show that it could have detrimental effects on the experience and on the efficacy. So we really want to get the most out of these infusions for patients. So we want to limit any potential interactions. I'm often asked, so what does ketamine feel like? Ketamine is very hard to describe. The best way I can describe it is patients have the sensation often of floating, flying. Sometimes they may see things and they may see colors, people, things from their past, abstract kind of objects. And oftentimes they may have dissociation. Dissociation is a separation of self from thoughts, some separation of themselves from their body. And although this may sound frightening, it can be a very therapeutic space for patients. Some clinics see this as a side effect and they avoid it, whereas I embrace it. As long as patients are educated, they understand that this is part of the process, that they're safe, and that this is a potential healing space. A lot of people find it very useful, very helpful to have that perspective. See different things in your life, what's working, what's not working, and what needs to change. Is it required to have therapeutic effects? No. I've had patients who've had no dissociation at all, yet they've had robust effects. Some people are uncomfortable with it. So the main key here is education, ensuring that they understand it, ensure that this is safe, and that this is temporary. Again, another reason why I use IV ketamine is because should somebody have anxiety-provoking response from dissociation, I can stop the infusion and wear off quickly. So I'm a firm believer that psychotherapy is just as important as the medicine. When ketamine clinics first opened up many years ago, a lot of them relied solely on the medications. Patients would come in, receive an infusion, and then go on their way. Whereas I think there's a lot more to be gained when we take a more holistic approach, when we think more about the patient and their lifestyle. We incorporate the psychotherapy and use it to accelerate the work they've already done. A lot of feedback I get from therapists that we work with is ketamine appears to be very synergistic with psychotherapy. It appears to accelerate the healing process. Often their clients are stuck. They're stuck on certain parts of their past and they're unable to get past that. Whereas, perhaps because of dissociation or perhaps because of the acute effects of medicine, having the ability to see their life and different aspects of their life can be very profound, allowing them to move forward and potentially heal even further. So the ketamine psychotherapy is not your routine psychotherapy. Obviously, I'm not a therapist. We have therapists on our team, and they could say it even better than I could, but there's something to it. This is different, especially when incorporating the medicine and all the different parts, the preparation and the integration that happens after and in between infusions. Let's talk about the process for a prospective client. So ideally, a client will be referred to me by a mental health provider, such as a therapist or psychiatrist. These are the most ideal candidates because they have the support, they have the team, they obviously embrace the psychotherapy. That's what I prefer, but obviously some patients, they find us through other routes. And the process starts with a consultation with myself and the patient. So the process starts with screening. This is where we identify the patients who can safely receive ketamine therapy. I have a thorough conversation with the patient, understanding their disease, understanding their depression. When did it start? What have they tried? What medications are they currently on? Are they engaged in psychotherapy? What is their social support like? What is their family situation? What do they do for self-care, exercise? Do they do any meditation? Is there any risk for behaviors of self-harm? These are all very important things that I talk about during the initial consultation. And then if patients are appropriate, I always encourage them that they can always talk to our therapist too. Some patients already have their own psychotherapist, which is great. I think we can obviously continue that relationship. And I definitely encourage them to schedule psychotherapy appointments with their personal psychotherapist throughout the process, hopefully in addition to our psychotherapists who are trained specifically with ketamine. The ideal candidate also is an appropriate age. My take on ketamine for adolescents is I don't think it should be a first-line agent. And the reasons behind this is at the young age, the brain is undergoing a neuroplastic process in itself. The brain is still developing. So I prefer when patients, if they're at a young age, they tried other modalities first. Ideally, they have psychiatrists. For patients to consider ketamine, they need to be medically appropriate. We'll talk about contraindications next. And it's ideal that the patients are educated. They've understood the process. They've read about it. They've visited our website. They've talked to their healthcare team versus jumping blindly in. Ideally, patients have support. They have a team. They have mental health providers on their team. They have family. They have somebody to talk to about their experiences. That just better helps integrate the process. And then ideally, if patients have the right attitude, they need to understand that this is not a magic pill, that this may be challenging, and this will require work on their end. So who should not receive ketamine? Patients include those who have uncontrolled hypertension, unstable heart disease, those who have uncontrolled thyroid disease. And the concern here is uncontrolled, untreated hyperthyroidism. If people have hyperthyroidism, they may have an elevated heart rate. And by adding ketamine, we can induce arrhythmia. So we definitely want to make sure that they're treated. One contraindication of ketamine therapy is a history of psychosis or schizophrenia. And that could include patients with type 1 bipolar disorder. And obviously, ketamine should not be used for those who have a hypersensitivity to the drug, for those who are pregnant. And then I put a question mark on active substance abuse. Like I mentioned before, ketamine can be very effective for alcohol use disorder, but also for cannabis, tobacco, opioids, cocaine. However, it's best that patients have a period of detox. I wouldn't want to treat somebody who is actively, heavily drinking. Rather, I would want them to refrain from that so we wouldn't have any interactions with the medicine, but also I don't want to put them at risk. So next important concept is set. And this refers to mindset, the patient's motives, their intentions, along with their emotional state. And although the patient can ultimately only control their mindset, we do our best to prepare the patients. We encourage them to do psychotherapy before their infusions, help them understand the process. So preparation includes understanding the patient. Why are they seeking ketamine therapy? What do they know about it, and why now? I always encourage patients to be well informed, spend some time, do the homework, read about the process, watch the videos, but also understand our process, our specific process. That really helps with any apprehension for their first infusions. At our clinic, the process starts with patients will come into our clinic. Myself, the physician, I place the IV after I check their blood pressure. Typically, patients wear eye shades and then a headset with music that I've curated for the experience. The music is a very important part of the experience, and oftentimes patients really enjoy it and find it to be very therapeutic. And then as far as details on the infusion, so it's 40 minutes long. It's important that patients understand the medicine in that the half-life is about 3 hours. So in about 3 or 4 hours, they'll feel back to baseline. However, that doesn't mean that they should just get right back into their busy life. I always tell people after these infusions is a very special time to slow down, time to process, reflect, rather than rush back into busy life, work, or emails. I always encourage people to listen to their body. Should they feel tired, take a nap, hungry, refuel, rehydrate, talk with loved ones, journal, do things to really focus inward versus being distracted, such as being in front of the screen. But certainly, I tell patients to expect to be back to their normal routine the following day. Prior to starting the process with us, I supply them with a comprehensive guide explaining all of this and more. I think just all the little details, for example, where to park, where to have your coffee afterwards, all those things really help with lessening the apprehension. And then patients also need to understand that they need a ride home after their infusions. And that could involve rides from a loved one and sometimes even an Uber. Preparation involves collaborative discussions with their family and their healthcare team, but also it involves fine-tuning different aspects of their life, including their sleep, their nutrition, exercise, stress management. Our therapists spend time talking about or helping with meditation, helping with mindfulness practices, which can be very synergistic throughout the process. And then preparation involves setting intentions, and that's with the therapist. What are they hoping to achieve from these infusions, and what are some of their goals? So next is setting. Setting refers to the physical environment and the team. Where are our patients going to receive the medicine? Setting is a huge part of the healing process, and it can be done wrong. I certainly believe that ketamine should not be utilized in a sterile medical environment, but instead somewhere that is warm, welcoming, attentions to the smell, the sounds, the feel, all these things are very important. Patients need to be very comfortable. I encourage patients to look at all the photos, even come visit the clinic beforehand, should that help them be more comfortable. Ideally, before infusions, we spend some time slowing them down. I've seen people who there's anxiety when they come in, perhaps a little bit late, whatever is happening prior in their day, they have this anxiety, and that sometimes carries over into their infusion. So if we have time to slow down, do some breath work, some meditation, and it can be as simple as a few minutes, that can make the biggest difference in the world. And then at our clinic, I think it's very important to have a presence in the room at all times. We call this holding space. Majority of the times it's myself. I'm in the room, and that's mainly to be there for support should they need it, but also to monitor them and also to control the infusion pump. Should something come up, I want to be there and be able to help them right away. But sometimes patients will ask if they can invite others, family members, their own therapists. Yes, the answer is always yes, because whatever is going to make them most comfortable, I think is just going to make a better experience for them. So the next phase of care is integration. So integration involves what is done after the infusions, in between infusions, comparing and contrasting their expectations versus realities. This is where we talk about their emotions, their insights. These can be very profound experiences for patients, filled with insights, motivations, memories. And it's about taking notice of this, but also doing something about it. The ketamine process requires willful participation. Patients need to not only undergo the experience, but really utilize these gifts, these insights, and make changes in their lives. This obviously is with the help of our psychotherapists, but also on their own. They need to recognize that this is a delicate time, and now is the time to take action. Ideally, the integration also involves, like I mentioned, the psychotherapy during that critical period. During that 48 hours is the ideal time to incorporate therapy, whether that be with their own personal therapist or with our psychotherapists. And like I mentioned before, with the critical periods, now is a good time to start routines. Start taking care of themselves. It can be as simple as taking a walk every day. If people do things like this during the critical period, it's more likely to stick and more likely to be more long lasting for them. Ideas for integration includes, simply talking about it, so joining support groups, and then psychotherapy, and more psychotherapy. So let's talk about the potential risks and side effects. Ketamine is a very safe medication, especially at the sub-anesthetic doses. However, patients may experience nausea, and that's typically associated with higher doses and with visual stimulation. For example, when patients don't wear eye shades, they can have double vision or nystagmus, which is basically quivering of the eyes, and that can certainly induce nausea. I'd say about 1 in 50 people have nausea, and we treat that with Zofran. Sometimes we pre-medicate prior to the infusions, but most of the times it's just as needed. So after the infusion, if they have any indication of nausea at all, then we quickly treat it IV. Anxiety, it's normal to have some apprehension prior to their first journey with us. However, this typically lessens over time, and a lot of times people really come to look forward to their infusions. To help with anxiety, it may be as simple as doing some breath work, stopping the infusion for a brief period of time. We do have medications to treat anxiety. However, I've never used them. I've never needed to. It's just a matter of comforting and reassuring the patient that they're safe. Ketamine can elevate heart rate and blood pressure, which lends to the importance of close. And more rare side effects include bladder injury and issues with breathing or hypoxia spasm. So bladder injury, this is something that is seen with abuse. It's something that we're not going to see in a clinical setting, not going to be seen with IV ketamine at the doses we use. So when patients use ketamine daily at much higher doses, for example, like 2 to 4 grams per day, this can injure the bladder. The bladder can harden to the point where it can't hold urine properly. And sometimes patients actually require surgery. But again, at infusion clinics, the doses are much, much lower, about 30 to 100 milligrams. So again, something we're not going to see in the clinical setting, but something we have been seeing for patients who become addicted or abusing ketamine at high doses. And then ketamine, when given rapidly at high doses, so this is more commonly going to be seen in a surgical setting, can induce hypoxia, so decrease in oxygen levels, or it can induce laryngospasm, where the jaw locks up and the patient is unable to breathe. Again, something very, very rare, unlikely to be seen in a clinical setting, but it does require vigilance on the provider. And again, it really lends to the importance of close monitoring, and not only monitoring, but monitoring with a professional who can deal with this potential complication. It's a simple fix. You just lift the jaw so they can breathe and it quickly passes. But if somebody doesn't recognize this, or certainly if patients have this at home, it really can be a scary situation. So one can't help but see all the press about ketamine lately. Ketamine is definitely mainstream. However, a lot of it relates to misuse and reckless behavior of different people, some of them of which are celebrities. I think a lot of this misuse relates to the at-home ketamine, but obviously the recreational use as well. The problem I see with at-home ketamine therapy is the patients decide and dictate their own care, when to take ketamine and how much. They may start appropriately. For example, they may take ketamine when they have a depressive episode, but then that can lead to taking it in anticipation for a depressive episode, and then as a means to relax or to have fun, and that really opens the door for addiction. So like I said before, I'm really hopeful that there's more regulations in place in the future, because we can't ignore the fact that although ketamine is not physically addictive, it certainly can be psychologically addictive, especially when taken daily for those who don't have indications for it, and those who for it, it could potentially be very harmful. So how do we lessen this risk? Number one, I truly believe that ketamine should be only administered under medical supervision by a licensed professional, someone who knows the proper doses, but also knows the potential side effects and how to deal with it. I do believe that patients need to be monitored throughout the whole experience. Some clinics and some providers, they don't believe this, and patients will receive ketamine while alone in a room, which may be okay for some, but it certainly can lead to some big problems. So I do believe that it's very important to monitor patients throughout their entire journey. Also, to lessen the risk, I think it's important to use a proper dose of ketamine and a proper form of ketamine. The problem with the oral forms, the nasal forms, if patients are underdosed, they may feel better acutely. It could have an anxiolytic effect. But if they're underdosed, if they're below the threshold of 0.5 milligrams per kilogram, then we're not having the antidepressant effects. And what good are we doing them at that point? So they'd be inclined to take more and more ketamine, especially if they're taking it at home, because it helps them feel better acutely, but ultimately it's not helping the depression, so it's not doing them any good. And I also think to lessen the risk, it's really important to involve a mental health provider. Again, a lot of clinics don't believe this, and they believe solely on the medication, but I think having a provider on the team, seeing the patient throughout the series really lessens any risks, or it definitely helps with lessening the risk, but also in improving results and improving efficacy of the actual medication. So what are some common misconceptions about ketamine? One of which is ketamine illegal? Ketamine is a Schedule III drug, which means the FDA sees ketamine as potential to have harm, but if ketamine is prescribed or administered by a licensed professional, then it's legal. So it's not illegal. It never has been. Ketamine is a horse tranquilizer, not quite, but a lot of medications that we use are both used in veterinary medicine and in human medicine, such as Prozac, Tramadol. And so it's not a horse tranquilizer, but instead it's a very effective medication for mental health. Ketamine is a party drug and dangerous. It can be dangerous, but again, when used under supervision and close monitoring, it can be very safe. One of the beauties of ketamine is it doesn't affect the respiratory drive or hemodynamics versus the other medications and the opioids. If you take a lot of opioids, the concern is you can stop breathing. So ketamine is a safe medicine, but when used appropriately. Ketamine is off-label, which means it doesn't work. Also not true. A lot of medications, approximately 20% of medications that we use are off-label, used for indications other than were approved by the FDA. A lot of medications that we use are off-label. For example, propranolol, which is a beta blocker for social anxiety, Seroquel, which is antidepressant for insomnia, Viagra for pulmonary hypertension. So I don't want people to be confused in thinking that off-label means ineffective or not safe. One of the biggest hurdles for ketamine therapy is affordability. Ketamine therapy can be expensive. Why is it expensive? The actual medicine is quite cheap, but the whole process can be very, very costly. Professionals who are qualified, those who continue learning. Perhaps one of the biggest part of my jobs is research, reading, writing, but also attending lectures, conferences. That can be very costly, but that is very important. It's important to have a provider who follows evidence-based practices. The facility, the equipment can be very expensive. Curating a comfortable, welcoming facility is very important. Believe it or not, there's very limited insurance coverages for ketamine clinics. A lot of insurance companies don't recognize ketamine as an option for mental health treatment. However, I foresee that definitely will change. What I've noticed, however, is that ketamine clinics are starting to be creative. Various means to decrease the cost and in essence, increase access. For example, some clinics are starting to offer group therapy, something that we're working towards as well, in addition to couples therapy, as a means to decrease the cost for our patients, but also to foster a more community-based approach. I think a lot will be gained by having patients talk about their experiences with each other, what has worked, what type of things have they done outside of their infusion. So group therapy can be a way to decrease the cost, but also potentially even increase the efficacy. There's also some clinics or some providers offer ketamine in retreats. And there's different companies such as Anthea and First Track, which are offering ketamine as an employee health benefit. Both of these companies we're working with to offer this to people in our community as well. And then I'm sure a lot of you are aware of super bills, and this is something that we produce as well. And we've definitely noticed that over the past year and a half that more insurance companies are starting to recognize ketamine therapy. And we've had people who have been reimbursed 100% after receiving super bills. This is something that it doesn't work for everyone. This is an option for some. But I think ultimately what's going to be required is FDA approval. And this is going to require large and high quality studies to get FDA approval and hopefully insurance coverage. However, I think it's going to be more and more difficult for insurance companies to ignore and deny coverage, being that there's just so much evidence showing the efficacy and safety of ketamine. So this is just some key studies. I actually compiled this yesterday. And what I'm going to start doing is, in addition to supplying patients with super bills, I'm also going to supply them with, I wrote an article based off all these studies that I published yesterday, but I'm going to start supplying this to my patients so they can give this to their insurance companies, and hopefully that they can see all the research over the past 24 years showing efficacy specifically for antidepressant effects of ketamine. So some key takeaways today. I hope everyone understands that ketamine is a safe medication when used appropriately. It can be very effective, specifically for depression and treatment-resistant depression. I hope everyone understands the synergy that ketamine can have with psychotherapy, that IV ketamine is the most effective, the safest route of administration. I want to caution the use of at-home ketamine. Hopefully people understand the importance of the physical and social settings during ketamine therapy. Ketamine, again, is not a magic pill. It doesn't work for everyone, and it requires willful participation on the patient's part. We talked about integration, the work that is involved in between and after infusions. Ultimately, ketamine and psychedelics are here to stay, and they will be continued to be play a big role in psychiatry and the future of mental health treatment. However, we do need help. We do need more trained, dedicated psychotherapists, specifically trained with ketamine and other psychedelics. So a few call to action points here. For those who want to learn more, I encourage you to reach out. One of the biggest parts of my job is doing research, is writing, reading the papers, listening to podcasts. So for those who want to learn more, just reach out. I can definitely supply everyone with these. Our blog is very active. Every couple of days, I'm writing articles, again, based off of new research, common questions. I encourage people to join our newsletter to learn more. There's a great Google group called Big Tent Ketamine, and this basically connects all the providers around the world. And it's a great way to learn about ketamine, but also if you have difficult cases, to talk about that with other providers with a lot of wisdom. I encourage people to join or follow American Society of Ketamine Physicians, a great organization. They put on a yearly conference, which I go to, a great way to connect with other individuals, other leaders in this field. And then I encourage therapists or whoever to call us, to come visit us. I love it when people come to see our clinic, to meet our team, ask questions, and see if this is something that could be incorporated in your practice or could help your patients. And then for those who do want to undergo formal training, myself and our therapist underwent training with Numinous, and they supply us a coupon, but there's also a lot of other organizations who have great training programs should you be interested in becoming a ketamine-assisted psychotherapist.